So I'll be presenting this efficacy of compression sutures in the rapid resolution of acute hydrops in a case of Pellucid marginal degeneration. So this was a 47-year male who came to me on 14th March 2023 with the complaints of redness, blurred vision, right eye since one day. There was history of healed hydrops in the left eye a decade back. Uncorrected visual acuity in both the eyes was 6/60, and these are the clinical pictures where we see the ectatic thin inferior cornea along with corneal edema. So we had his pentacam in July 2020 when he visited us last, and now in March 23 where we see that the keratometry K max has increased from 76.7 diopters to 83.8. And we also note the edematous cornea, the pachymetry initially in July 2020 being 522, and it was now 904. And this is the AIOC picture, which shows the detachment with a break. So the three options available to me at this time was whether I do conservative management with topical hypertonic saline, steroids and anti-glaucoma medications, or we do the desmetopexy with 14% C3F8 and 20% SF6, or we go ahead with full thickness compression sutures with or without intracameral long-acting gases. So at this point I had a discussion with Dr. Sunita since we were all reading this paper of hers, and she beautifully guided me through her notes and diagrams how to proceed the case. So what she suggested was, she's already shown it with the side port entry AC paracentesis, place an air bubble for a small air bubble, and then to place the sutures. But what ma'am had suggested was this figure of 8 and vertical mattress sutures. I was most comfortable with placing radial sutures, so I went ahead with this. So this is, I don't have a surgical video, but this is how I just placed the radial sutures using 10-0 nylon. And this is the first post-operative day 1 picture where we see that the edema has cleared quite a lot. And on post-operative day 3, this was the picture when almost all of the edema has gone. And even on the AIOC, we see a very well-settled desmids. And the refraction, the patient's best corrected visual acuity had improved to 618 with a very minimal correction. So at 3 months later, we did the suture removal, and the uncorrected visual acuity being 6/36, though there was a change in refraction. So, and this is the final picture of the patient. And in topography, we again noticed that the K max from 83.8 had now come down to 61.9 diopters. So that was my case. I'll conclude over here.